Thank you, Lou. Well, look, great to join you. And as ever, Indy, your office is far tidier than where I'm sitting right now. I'm obviously far more relaxed. Anna, welcome. Well, it's great to speak to you both, because we've heard so much today about discussion in public sector, in research, and what's been happening in the NHS, and some amazing colleagues who have really shared their perspectives on everything diversity, inclusivity related. And it's not often that we speak about what's happening outside of the sector and how we can support, what views we might have. So it's great to have you both. And I'm just going to give you both a moment just to explain who you both are, and I'll just share who I am. I'm Sam Shah, as Lou said, and I'm working in a private healthcare organisation, but also in academia at the moment. And obviously, for some people that know, I previously worked in the NHS in a number of roles. And one of my favourite topics was inclusivity and diversity. And sometimes I suppose, shook the cage a little bit and occasionally said things that may have been a bit controversial. But, you know, from my point of view, I think across the system, we don't often get this right, whether it's in public sector, private sector, or anywhere. And there are so many people trying to solve this problem, because we probably all recognise, especially now more than ever, that inequalities across society have to be solved through collective efforts, and one of those is having an inclusive workforce that can provide that diversity of thought and better decisions and better outcomes. So my perspective on this really is how do we solve this? So public sector, private sector, or anyone solving a public service issue can try and get the best outcome for citizens. So with that, Anna, would you like to just briefly introduce yourself?
Sure thing. So thank you, first of all, for having me on today. So far, it's been really insightful, and I'm looking forward to seeing the rest of the presentations this afternoon. My name's Anna Townsend. I am a healthcare partner manager at Amazon Web Services. And for those of you that don't know what AWS do, we're a cloud computing infrastructure hosting company. The companies that I work with are healthcare technology companies, health tech startups who are building solutions to solve problems within the NHS, and I'm helping them sort of navigate the cloud world, navigate the complicated bits that go around compliance within healthcare, for example, helping them fund projects, helping them build marketing strategies, and everything that goes with it. So I've spent a little bit of time within the NHS, but largely within the health tech world. You might see the strange poster behind me. My husband is actually a fifth-year medical student who's about to graduate into the NHS. So I kind of see that side of it as well. So diversity and inclusion is really important to me. Obviously, as a woman in the tech world, I'm often sometimes the only one in the room, in amongst a room full of generally white, middle-aged IT men. I'm sure you've all encountered that. So really looking forward to the discussion today.
Thank you, Anna. And Indy, you know, you are probably that exception in the room. You're not white and middle-aged. So tell us a bit about yourself.
Yeah, so often, kind of, as I said, the only turban on the table, so to speak, in many a meeting that we've been at, Sam. And yeah, pleasure to hook back again. So I worked nationally in the NHS for a number of years, leading up on a number of different initiatives around integrated care, etc. Moved over to PA about a year ago, working on health transformation and also at the same time digital transformation to support that. What's been interesting is, I think, when you move from public to private, actually there's a recognition that actually, if you're going to have to support a diverse workforce, you need to think in a diverse manner. And one of the what's been interesting is working back with the NHS colleagues is, prior to COVID, I think people kind of understood this was important. COVID has absolutely made this not even a question anymore, but a necessity. And I think as part of that, what we need to then start thinking about is not just doing it for doing its sake, but genuinely understanding how it's really going to solve a serious set of health and care problems that we're now facing.
And, you know, for both of you, there's so much to discuss when we think about diversity and inclusivity, and it's not just about race, but it's about so many other aspects that go alongside it. But of course, race is a big part of that. And Indy, if I may just start with you, like, what do you think that it is out there that that you're doing, and moreover your company's doing, just to help shine a light on the issue, but also some of the things you're doing to solve that particular dimension of diversity?
Yeah, so I mean, what was interesting when I joined PA and the BAME network was one of the key start things up front was the lead of it is a non-BAME partner. And I think this is one of the things that's really important, that with inclusion and diversity, often there's an assumption that it's those from a diverse background that then need to be the champions for it. But actually, for me, it's completely the other way around, where it's actually about everyone else in the room working with those from a diverse background to really understand what the needs are in totality. So I think that was quite a refreshing change. And I think that the other bit, kind of there's 3 points. One is that recognition of leadership and the fact that it shouldn't have to only be those from a BAME background that are driving this agenda. The second one was more of a personal experience around authenticity. So we'd had obviously from lockdown various kind of communications, and there's a corporate email from the CEO around Black Lives Matter and some of the issues that are going on around COVID. And one of the lines at the end kind of said, and importantly to remind everyone, we're not doing this because it's the right thing to do. So we're not doing this because it's kind of cool and trendy. We're doing this because it's the values that we're trying to operate against. And I think that point of leadership and authentic leadership, that really resonates with people when they know that actually this is being done not for a political show or because it's the right thing to say, but genuinely because it's the values in which we operate against. And then kind of the final bit is responsiveness and action. So one of the things I kind of raised back to CIO at the time was small things that are going to matter quite a lot. So there was a whole question around return to work and how do people get back and start commuting and so forth. And actually, as a BAME group of people, we're high risk. So jumping on a train to London is a very different thing to those that are not from a high vulnerable cohort. And so even simple things as people returning to offices, you can't just assume there's a uniform approach as to how you deal with people returning to offices. So I think it's that kind of what I've seen, which has been quite refreshing, kind of moving in the private sector, is that point of leadership and genuine, secondly, authenticity in that leadership, and also just understanding some of the intricacies and some of the detail. It was one of Indra's great points. When you say we're Asian, and Asian covers off, a multitude of different backgrounds, but actually understanding those intricacies as to what does that mean for the individuals that we're trying to look for as part of our workforce.
I mean, Indy, that's great to hear that, it's very much sounds like it's a listening organization, and it's not just listening, but it's taking proactive action after hearing what individuals have to say and tailoring around that. And with that, Anna, thinking beyond sort of race and, knowing the size and scale of AWS at that sort of global level, what is it that AWS is doing that's the race agenda, but also wider, for the other areas of diversity that we need to really think about as well?
Yeah, I'd actually echo one of Indy's points, the first one around not necessarily having the people from that group being the champions, of that diversity. And that's something that's really apparent at AWS and at Amazon as a whole. So AWS is obviously a part of Amazon, and our diversity, initiatives are spread across that. So we have things like the BEN, the Black Employee Network, or Glamazon, which is our LGBT community. And actually at the top of all those organizations, you obviously have people from those groups, but you have allies and champions who are working alongside that to help drive that agenda, and that goes all the way up to our senior teams and above. So that's part of it. And on a personal note, I'm actually a part of a couple of programs which I'm really sort of proud of to work with at AWS. The first one is a program called Get IT, which is encouraging young girls to get into tech, so that we've we know that only 17% of people in the technology workforce are female. And actually what Get IT does is we run a program, and we kind of gamify it, I suppose, to take to year 7 and year 8 students to enter a competition to build an app that Amazon Web Services then builds. So they have to build an app and design it based on a problem they're seeing in their community or school. They have to have 50% of females within their groups. So that obviously encourages the boys to join as well. And then they enter a competition to do that. And actually last year we had over 100 schools take part and be part of that. And we have some incredible, female talent from not just from AWS, but from across the industry who really sort of drive that and are fantastic role models for those girls. The other thing that we look at as well is it's sometimes the kind of unspoken diversity, which is around different socioeconomic backgrounds. So people who might not necessarily have come up through university. So Indra before was talking about tertiary educated. That seems to be a bit of a standard, I imagine, in the NHS and also at Amazon. But those people who haven't necessarily had that. So we have a program called Restart, which works with a lot of ex-military veterans, but also people who have been out of work for a long time. And it's a 12-week program where we train them on cloud skills, which we know is a huge gap, a global skills gap for the industry, not just for Amazon. And then, help them find jobs within the industry. So 2 programs that are absolutely really, really close to my heart and that, I'm really proud of.
And I'm really glad you just sort of touched on education there, because whilst that's it's fascinating about what you're doing at that global level, especially around women in the workplace and a tech environment, but also moreover around education of those people that might be from deprived communities. On the other side of education, how do we go about educating our workforce, especially AWS got a global workforce? How do you educate them about the issues surrounding diversity and help people to sort of have those uncomfortable discussions?
Yeah, so something we're really proud of at Amazon is what we call our affinity groups. And I mentioned a couple of them before. So the BEN, the Black Employee Network, Glamazon, which is the LGBTQ+, People with Disabilities Network. And these are global affinity groups that people can join and then be part of. And we run conferences every year, virtual this year, of course, that people are encouraged to join. We run a number of different events. We have a Women at group, which is really focused on helping sort of women in the tech industry. And actually, we've got an event coming up that's sort of a little bit more off the wall about how to help women, own and manage their finances, for example, which is something that's not really, talked about. So yeah, these affinity groups are a fantastic way of being able to connect to people around the world, and cloud is a fantastic tool to be able to do that, because once you're online, you can connect to anyone. So yeah, that's something that we work with quite closely.
And Indy, how about for you? I mean, I know from conversations we've had and having met so many of your team that I tend to get the impression that PA people are warm and inclusive, and it very much seems like it's part of the ethos of the place. What's happening across the company to help sort of educate new members of the team and really start to share those views that help transform not only what you do but what you take to your clients as well?
Yeah, absolutely, and I think it goes to the heart of what you're saying. So we talk about kind of ingenuity, and you can only really get ingenuity in how you deliver for clients if you're thinking in a diverse manner, and you're thinking, actually, what are the totality of the different users that I'm going to have to deal with here? And so one of the key things that we're doing, and it links to some of the wider allyship work that's going on. In any cases, we've got our own allyship networks within PA, where purposely we're getting people to think about what it means from those from a diverse background and actually live that experience with them, because there's nothing quite like actually having that one-on-one interaction, that one-on-one set of conversations. And also recognizing that our clients themselves have a much wider and diverse workforce. I think the key point is, as you're saying, is if you build it in from the start that says, look, the world has changed now, and actually we have to, right as a default, think about how we're supporting diverse needs and diverse workforces, right? How do we do that? Well, let's understand our own diversity within our own organization, and then also the diversity of the clients that we're delivering to. And
what about programs? I mean, Anna, you've spoken about some of the programs that Amazon's involved with. Are there other programs out there just available to industry that you're aware of or that anyone's been accessing?
So thinking about healthcare specifically, whilst we might not be aware of any, what we would love to be able to do is to share what we have and to encourage, the NHS to come and work with us and talk to us about how we could potentially help you develop those programs. So and a colleague of mine who I believe was working for NHS England, Nikki Murphy, who was talking about a graduate management program at NHS that she worked with, and she did a 2-month flexi placement where she went and worked in social care. Is there an element of diversity that we could include in that, and make that a 2-month diversity placement learning within a community within Amazon, for example, or vice versa, so that we're sharing those learnings. On other programs, Indy, I actually worked with some of your colleagues at PA on one of your diversity programs. It was, I can't remember what the name was, but I was a judge on a coding program.
Yeah,
it was amazing. It was so insightful to see. I don't know if you wanted to talk about that.
Yes, I mean, it's interesting. We have an entire Women in Tech stream, Sam, and interesting, a lot of the other industries, whether it's defence, whether it's finance and so forth, actually there's been a number of courses that we've done across clients that we want to encourage much more in the health space, but also the Raspberry Pi work, the competitions that we run, the Code First for girls that we run as well. So really, as you're saying, kind of getting a much younger cohort and encouraging them not to think there's any false barriers there.
And both of you, your work with clients across other parts of public sector as well for your organizations, are you tending to find that it's very different outside of healthcare? And is there anything that you found through your other programs that we could learn from in the health sector?
So,
Indy, you can go first.
Yeah, I was about to say. So, I mean, we there's definitely industries where there's been a lot of work that we've been doing, and interesting, like defence, security, financial services, and others. I think with healthcare, there's something around really understanding the why this is important. And weirdly, out of all the industries, healthcare is probably the one where you as opposed to retail, where we all buy a breakfast cereal from the same shop, and frankly, that there is some diversity, but not fundamental. But with healthcare, the fact that most BME will present at stage 4 instead of stage 1 of cancer because there's a massive taboo around being able to articulate these things, means that if there was ever one industry where the digital channels needed to be tuned for diversity, healthcare is absolutely that industry. And I think in that way there's definitely learnings to be taken from other industries around not fearing diversity and addressing it. I think there's also something in healthcare of recognizing that actually it's fundamental to how you deliver healthcare.
I think that's really important because there is something about healthcare that is quite special. Of course, it's quite a sensitive topic area, and sometimes that dimension can get lost. But equally, I guess the opposite happens, where sometimes in healthcare we are entrenched in our own ideas and views, and that also includes how our teams operate and are structured. But I think that's a really important reflection. Anna, how about for you? Are there things that you're finding out there from other areas that you and the team are working on?
So I'm relatively new to healthcare. My background's in retail, so I've spent only 2 years, but I've actually been incredibly impressed with a lot of the diversity around the technology that I come across, and actually the way that it's being approached. So I think it's probably vastly different from how it was 10 years ago, but I still think there's a lot of work to do. So I'd really love to be able to have a cross private and public sector working group, for example, to how we could address it, or let get involved in some programs. I think collaboration is absolutely key. So not sort of bringing anything else from any other industries, but I just think there's so many voices to be heard and so many ideas that we can help sort of channel those, which the NHS might not be able to do.
I really like the idea of that collaboration, because I'm sure there's lots of colleagues out there, right, who'd want to spend time with any of our teams and want to do a bit of learning, and it will help our team, both directions. There's probably something there that we can gain from it. I mean, Indy, you've been working in transformation for a very long time. Are there areas of transformation you're seeing in technology where if we had a little bit more join up on that collaboration, we could get perhaps more diversity of thought, and perhaps even better outcomes from our programs?
I think absolutely, and I think there's a freshness and sometimes there's I think sometimes some concerns from inside the public sector as to how far we can go and how far can we really innovate and challenge the status quo. I think from a private sector perspective, that's part of the challenge, is to say, well, how can we do things differently? So I do think, especially around kind of the patient engagement side of things, especially around the use of data, and actually how can we start bringing some of the expertise from private and public sector together, along with research and so forth, to really bring out the best. I personally still don't think that we're optimizing all the skills that we have across private and public sector within this.
And I think, on that, I don't know how much you know about this, but previously in my last role, I spent a bit of time with some of your colleagues at Amazon, and they were great about different ways of working that gets that sort of creativity in a team, but by having that form of diversity, but giving people creative space. Are there things in the way in which Amazon works that we could learn from in public sector more generally about how we could foster that culture?
Yeah, absolutely. I think, Indy, you kind of mentioned a little bit. So in tech, obviously, we love to talk about disruptors and how who's the next disruptor? Well, why couldn't we be diversity disruptors, right? That could be, completely shaking it up. We have actually, the way that we tend to work at Amazon is we work in what we call 2 pizza teams. So we will never have a team bigger than can be fed by 2 pizzas. And actually that kind of leads to things being able to be done a lot quicker. So taking that from a diversity point of view, we've got all these incredible ideas. Why not put together a couple of 2 pizza teams that would be able to drive something quickly and disrupt in a sort of speedy basis. Another thing that we do is and actually with a few my colleagues on the healthcare team who speak to sort of the NHS on a regular basis, what we're asked to do a lot of the time is something called the art of the possible. So how can we use our services and the technology that we have to solve some of the challenges that exist in the NHS? And a lot of the time the questions are around diversity. So they know they've got this data set. How can they make it a lot more fair and across everyone? Or how can we use those interesting technologies to sort of help and be disruptive, I suppose.
I love that concept of the pizza team. I think that's absolutely fantastic. And Indy, we've spoken about this at length before, but what is it we can do from what we've seen to encourage excellent colleagues in public sector to build those inclusive teams, to find a way to bring that talent in?
I think I was reflecting on this morning. I think it comes back to the why. So a lot of the times when we've historically thought about diversity inclusion, we do it because it's the right thing. Well, actually, you need to kind of go back a couple of steps and say the only way you're going to be able to deliver health and care services is, by definition, you've got a diverse set of population that you're serving. Therefore, you need diversity of thought to recognise those diverse populations. Therefore, you need diversity of teams to give you that diversity of thought. So it's actually kind of taking it right back to 101 principles, saying whether you're a chief exec or a DOF or a frontline clinician or so forth, you're not doing diversity because it's a good thing to do. You're thinking about diversity inclusion because the people that you are serving are diverse and need to be included.
And that's so important, because that's really thinking about the outcome, the people that will benefit, and it really gives that reason, similar to what I suppose Indy and Maxime were speaking about a little bit earlier there. And Anna, you'll have access to data at a global level, probably like none of us in any other sector. Is there learning that comes out of that? And does that change that sort of approach because you've got so much data available?
So having data available, so we're obviously completely very secure with our customers' data, and we don't have access to that in the same way that you're sort of expecting. But Amazon, as a customer of AWS, so Amazon Retail, for example, able to utilize that data to potentially take some of that the bias, I suppose, out of it.
Yeah, no, and I suppose no, not personal data. I mean, I guess in terms of sort of global trends and that kind of thing. I guess. Sorry, apologies.
No, my mistake. Yeah, the trends piece is really interesting. And actually, some of the sort of trends that we're seeing is largely driven out of the affinity groups that I mentioned before. So they're really empowered. They're given extra time to sort of outside of their day jobs to go and drive the agenda based on those trends. So yeah, that's very much being driven at that level. And I suppose that's one of the joys of being a global company, is that what is often happening in one country is very similar to another. So
I think there is something that Sam just picking up that in terms of that whole data space of really thinking about the intricacies of the different diverse cohorts. So even just on a humorous level, I always give this analogy of, shockwaves probably don't realise that the majority of people that use their product to seek blokes using gel for their beards. It's just, but there's something around understanding the nuances of different cohorts and making sure that that's built in as part of the data capture. Often when I'm looking at forms and it'll say, are you British? Yeah. Are you Asian? Yeah. I'm like, that tells you nothing about me. And so I think there's the next level of detail, and if we're going to genuinely start making our care personalised and person-centric, around really starting to understand what are the needs of different cohorts at a much more granular level.
Well, that is powerful, and I do like the example about how we identify ourselves and the beard. And any final comments from you?
So something that Indra said about using the power of networks, so talking to people from other perspectives, I think that is the key thing. So how can we learn more from the NHS and vice versa, to disrupt this together? So yeah, use the power of your networks, and by all means, if anyone wants to reach out and talk more to AWS, please feel free.
I think you're right. I think the idea around a private-public collaborative, Sam, I think we'd all be really keen to think about that.
I think there's some great messages that come out of this discussion. I could have kept on speaking to you both for hours, but certainly around the power of some collaboration between industry and public sector. But most importantly, there is Turban on the Table, Glamazon, and Pizza Teams, which I will not be forgetting. And with that, thank you so much. Thanks for joining, and it's been great talking to you both.
Thank you so much for having us. Bye.
Thank you, guys. Really, that was great. I think we could have all listened for a very long time. That really was super. Really good stuff from you there, Sam, Indy, and Anna. Thank you.